It is Tuesday, December 22nd. Welcome to the Kahnawà COVID-19 Task Force update. It is our 163rd, and this one is a very important one. We'll start things off with the Commissioner of Public Safety, Lloyd Phillips.
Thank you very much, Joe. Good evening, everybody. Well, it's certainly been an interesting several days and actually several weeks here at the task force, looking at a lot of variables that have been happening in and around our community. And we did have a task force meeting today, and there was some important information and some decisions that were made that I'll relate to the community in just a minute. But we also have to take note that in Quebec, again today, they had a record number of positive cases. Another 28 or 30 people have perished from COVID-19. And these are numbers that we've been seeing consistently over the past couple of weeks. And sometimes we kind of get numb to the idea of when we hear, these numbers, but have to remember, behind these numbers are people, are individuals. And having 30 people a day and climbing, perishing from COVID-19 is very serious. And currently, in the community, the second wave, we had more cases in the past couple of months than we had seen in an entire pandemic, which is unfortunate. We have more active cases now in the community than we ever had, as well as more people in isolation as a result of COVID-19 since the beginning of the pandemic. So the overall situation in the community, although is not terrible, it's the path we're on is certainly not a good path. We have to find ways to turn that around because we're trying to avoid a major outbreak in our community during the holidays and certainly afterwards. As you may know, Quebec, as of December 25th, is going into a near complete lockdown for a period of 2 weeks, starting December 25th to approximately January 11th. And just today it was announced as well, Ontario is doing something very similar for a period of the entire month of January. These measures taken in other jurisdictions are taken to try to break the cycle that we're currently in, whereas the transmission of the virus has no signs of slowing and the death rate is continuing to gradually increase. So that's the unfortunate reality that we're facing at this point in time. So with that in mind, several tough decisions had to be made by the task force. And right now I will outline the preliminary decisions. Keeping in mind, tomorrow more information will be coming out in the written form, both publicly as well as individuals who are impacted will get letters directly delivered to them so that they're clear on what the directives are and what they impact you or if they impact you. So I'll start with the visitation. Right now we have put out a notification to the community that the visitation of one family per day is permissible during the holiday period from the 24th of December to the 28th, having one family visit at a time, one per day. Again, this is done purely for the fact of trying to minimize any potential spread of the virus, and I know many people have already taken measures to modify their Christmas holiday season to adhere to these guidelines. But effective on December 29th, that will cease. And we're going to return back to household only, whereby only the people who reside in your home will be permitted to be in your home. It's very crucial at this point in time that we implement this, and we'll make sure we do it right after the holidays, so December 29th be household only. And this will come into effect the 29th and will last through the month of January until January 31st, at which time it will be assessed and we will determine the next steps in the weeks leading up to that January 31st. There are some exceptions. As we did in the past, anybody who is a caregiver to an individual is permitted in the home. Anybody who requires babysitting services, that's permissible as well, because it's important to operate your family in that manner. Anybody who is in need of mental health support, or anybody who lives alone. If somebody lives alone, they are allowed to go visit another household. Again, for the sake of mental health, it's important that somebody is not isolated alone for a period of a month. So there are some exceptions to the rule, but generally for the masses, it's household only. And we'll be, like I said, putting this out in written form over the next day or so it's clear for everybody. Also, people may ask about deliveries and such, as we've seen during the first wave. Deliveries of goods to your home is permissible. We ask people to be careful as well. Mask, hygiene, distancing. If you have somebody coming into your home to deliver items, or if somebody has to come into your home to do internet connections or to do plumbing repairs or things of that nature, again, same rules apply. No mask, distancing, and hygiene. Keep as much distance as you possibly can. So that's regarding the visitation and the modifications and the direction moving forward. As what we also looked at was the situation around us and what's happening in other jurisdictions. And again, like even some of the measures they're taking is to protect the healthcare system around throughout the province, including Annalberge, just down the road. Many of our Kahnawà attend or go there for various medical purposes. They're strained. They are having a hard time dealing with the onslaught of COVID patients, along with the additional requirements that hospitals do. Same thing for a hospital like Jewish General and the Glen, which I know a lot of Kahnawà go to. They are at their breaking point, and they're asking people who don't require to go there to avoid their institutions. So that sends a major red flag, and the goal of what Quebec and Ontario are trying to do, and our goal now is to minimize the movement. As I said before, the virus only moves if we move. So when we start asking people to stay home, because as of the 29th, we are also going to be taking the next step in terms of business closures. So effective on December 31st at midnight, so basically January 1st, all non-essential retail businesses are going to be asked to close. So that includes businesses and factories, which we know and understand a lot of that includes the tobacco industry, and so they are going to be asked to close effective December 31st. I know many of you are aware that there was some discussions that already took place to try to make sure people have lead time to be able to properly prepare, for a potential closure. I appreciate the support that many of you have expressed, and you haven't noticed now that, excuse me, as of December 31st at midnight, those businesses are to close. There are other retail businesses that will be impacted. And those people will be notified, by hand-delivered notice tomorrow. But if you are not in the retail business, and then for the most part you are not impacted by this directive, such as many parts of the construction industry, some therapeutic services, convenience stores, and gyms at this point are not impacted. But that's something that could change, as things evolve over the next little while. But again, this will be all relayed to everybody in writing tomorrow. All these businesses who are impacted are eligible to apply to the Business Interruption Fund at the Dewaduni-Zakta. They also have the email. It's relief@mck.ca, and all the employees who are impacted by these decisions are eligible for the Kahnawà Economic Relief Measures, the KERM Fund. So that is available to you. So if you're impacted by these decisions, you will be able to approach Dawadou Nzakta and or the community-based services of MCK on Monday, January 4th, and apply for your assistance. These measures are going to be also in effect until January 31st. So we're going to have roughly a 4-week period where we're going to put a pause on these activities to stop the movement in and around our community, and we are going to monitor it closely and make adjustments as we go. We're hoping with this pause in activities, with the pause happening in other jurisdictions, that we will help flatten that curve, as we said in the past, break the trend, and keep our community safe and minimize the potential of any major outbreaks in our community. So with that, I'll be in touch again soon. Keep in contact with our Facebook page. We'll be putting out more information in the next day or two. Onigawahi.
And absolutely, there will be more information coming out tomorrow. I know it's a holiday for many after tomorrow, but we will be here, that's for sure. Coming up next is Lisa Westaway from the Academy Memorial Hospital Center with, again, plenty of important news.
Thank you. Firstly, I'll give you an update regarding our testing sites. So as of today, we have 7 active cases. We have a new case that was identified just seconds before I came up here to speak, so we don't have a lot of details about that yet, but we do have 7 active cases. As of tomorrow, we will be at 5 active cases, as the 2 of those 7 will have gone through their recovery period, so they're 14 days of self-isolation. 10 days of isolation after being identified as positive. So as of tomorrow, 5 active cases. But as you can see, we continually have new cases, and that's another reason or cause for concern. We expect to have cases as we see what's happening around us, but the idea in the measures that are being implemented today is to minimize the spread, contain those cases to the host case as much as possible. And that's why, although we didn't speak about it today, over those 4 days, over the holiday period where you can have one other household in your home, it's extremely important to respect the measures of distance, hygiene, and masking. And we ask that you plan in advance so that you can be sure about how people will distance within your home, because planning allows you to make better decisions, I guess, on the day of when people are in your home. And again, that is a recommendation if it's what is best for you. However, the task force does fully recommend that you stay within your own household over the holidays. And again, if you do have another home in your home, another household in your home, that you respect the measures. So I'd like to move on to provide the community with information about vaccination. This is actually historical, and so it's really important that we give you this information. And as of tomorrow, 20 employees from a mixture of Elders Lodge employees, ILC employees, and KMHC employees for our residents will be vaccinated. This is really exciting news, and I'd like to just give you a little bit of information about the rollout of the vaccination period or campaign here in Quebec. So as you are aware, Dr. Gauthier spoke about it in her video last week. Quebec now has approved and has access to the Pfizer vaccine, and that vaccine cannot easily be moved, and therefore it is being distributed at 2 locations in the Montérégie, and the one that is particular to us is at 1030 in an old or a closed store in one of the mall areas. And because that vaccine can't be moved to different areas, we have to go to the location of administration of the vaccine, and that's why Quebec has prioritized healthcare workers of of residences, so of long-term care facilities, of intermediate resources, and of family-type resources. And so that is why we have prioritized our staffing. What is important to note is that for this first delivery of vaccine to the Montérégie area, we have 4 vaccination dates where our employees will participate in the vaccination process on the 23rd, 24th, and the 26th, 27th. So again, tomorrow we have 20 people, but we do have staff members, including our own community members, who are being vaccinated over those 4 days. So it's very exciting, and we will be sure to bring you information about those vaccines that happen tomorrow through pictures and communication. The next step is about vaccination of our residents. And so what we're expecting is that the Moderna vaccine will be approved, if it wasn't already today. We've been in meetings, so I haven't heard, but will be approved either today or in the coming days. We still have very, changing information regularly about distribution of that vaccine. However, what we are expecting is that our residents will be vaccinated with that vaccine. So you will be receiving more information as we receive it as well. Those family members who have power of attorney will be receiving phone calls in order to discuss consent and give you a little bit more detail about the vaccine process. In terms of vaccination for the mass population, we are still in the planning phases regarding that, and we are looking at potential sites. And so I think it's just important to communicate that as a task force and at the hospital as well, we are participating in various provincial and regional meetings in order to ensure that we're at the forefront of the vaccination process for our community so that we can be as protected as possible, as quickly as possible. And we'll continue to provide that information to you as we receive it. So this is really great news. We are thrilled to be able to give this positive news despite the difficulties that we're expressing today. However, we do consider the measures that we're implementing measures that are for safety purposes for all, and therefore another step in bringing us to the conclusion, hopefully, of this in the coming months. Just a little add-on for vaccination purposes regarding measures, distance, hygiene, and masks. It will take many months before the community is protected enough through vaccination to be able to forego all of those measures. So we will still have them in place, whether we're vaccinated or not, for the coming months. And again, we thank you as a collective for following these measures. We probably won't see you until after the holidays, so probably only next week. So again, we thank you for your continued support, for the respect and the collective following of the measures, and we look forward to seeing you next week. Thanks.
And thank you very much, Lisa. Of course, Lisa and the entire gang at the Cattery Memorial Hospital Centre doing a tremendous amount of work to get to the point where we could make this announcement today. I think we are a very fortunate community. So again, more information will be coming out tomorrow on, you can check out Kahnawà 911. You can also check out other sources. You know, we'll have it at Kahnawake.com. There will be just information all over the place over the next few days because it is, we are entering a very difficult time. We've been in, but if, you know, the Quebec region has had over 2,000 new cases a day for the past 3 days. That's never happened before. And so, you know, the measures taken are just for the right reasons, not for anything else. So with that, we'd like to, again, thank you for joining us today, and we would wish you all a very happy holiday. We will be back for sure on Tuesday the 29th, and then once we get past the holidays, we will be back to the regular schedule. If there is an absolute need, we will be here with other updates for you. So on behalf of everybody at the Kahnawà COVID-19 Task Force, we wish you all the best. Be safe, Merry Christmas, and a Happy New Year.